Yeah, so in critical care medicine, every minute counts. I'm sure we've all heard about that, but it absolutely does. It shows that it can be an increase, a 30% increase in survival if you can reduce the time from a critical injury or head injury or bleeding to get them to an emergency department to get the treatment. And so sending a helicopter, it speeds everything up. A lot of the time it's actually hard to reach, so they need to use a helicopter. And then the other thing is that it's just a specialist team that exists in these helicopters. I mean, these are incredible teams. There's the paramedics, there's the pilots, and the pilots are the best of the best pilots. There's those working the winch, there's flight doctors in these as well. So the ability for them to provide life-saving, intensive care, critical care medicine, like right there at that point in time, it quite literally saves lives.
Especially if they don't know exactly, how bad somebody is, I suppose, too.
Yeah. And a lot of the time that is the case.
Yeah.
You only get a little bit of information.
Yeah.
And so these things are so fully equipped that they can deal with those scenarios.
Yeah.
So you said every minute counts, which I'm sure it does. So how do they deal with the pressure? So that is a lot of pressure on someone's shoulders.
Yeah, you have to be a very specific type of person to go into this. So obviously, there's a lot of training that goes into critical care medicine, then, take it to the extreme of doing it in scenarios that are completely unpredictable. And, I mean, we all understand that it's just not on the nice days where these guys get to fly their helicopter to, help people. It's usually bad weather, difficult landings. You can see the winching onto the cliffs. And so there's a lot of training that goes into being able to not only handle the pressure associated with that, but also the traumatic nature of what you are landing to not know. So, primary road accidents, other types of scenarios. So, yeah, there is a lot of that goes into not only the physical toll that plays, but also the mental toll that it plays. But, incredible part of what we're very lucky in Australia to have is these types of professionals.
Yeah, and we saw a beautiful moment where the family actually got to reunite with someone that rescued them. Does that happen very often?
I mean, I don't think it happens a lot, but a lot of the paramedics and a lot of the different organisations that do this, I know they like to do that because these aren't necessarily just, they've got to be funded somehow, so the funding needs to come. And so, being able to let people understand, that we don't pay for that. The other thing is in other countries, a lot of people would be worried about how much that costs. So, I think, having worked in an emergency department, and we know that, when we hear the chopper coming, a lot of the time we know it's coming, but when you know it's landing on the roof, the patient shows up and the amount of work that's been done before they get to us is incredible, amazing, to be able to, stabilise that patient and potentially save their life.
And then those paramedics are phenomenal. I mean, paramedics everywhere are, but these guys must have a whole extra layer of training, I would assume, to be able to do what they're doing, different to a ground crew.
Yeah, and I recently was lucky enough to spend some time with the crew up in Queensland, and a lot of, during our training of emergency medicine, we do retrieval medicine, and so we go through these types of training, and it's the constant training that goes in. It's the constant learning, sharpening of those skills, being ready for anything, and I think that's part of what makes this job, one, I think, exciting, for a lot of people, but also extremely challenging.